Good morning, everyone. Thanks for coming. I appreciate it. We're excited to announce and talk about one of our new products that's coming out fresh today called DataPRO. So I'm just going to jump right in. Feel free to jump in with questions, though, along the way, or I'll just stick around afterwards and we can answer all of your questions as well. So real quick, PatientIQ. PatientIQ is a healthcare software company that was founded in 2016, back when I was in medical school. And our company's been singularly focused on the importance of patient outcomes and not only measuring patient outcomes, but really providing performance feedback back to clinicians on how to improve them. As we've been doing this, we've had this great privilege of working in virtually every care setting across the United States to collect and measure patient outcomes in collaboration with clinicians. So by doing this, we've now been out in the field, out in the hospitals, out in the clinics, working hand in hand, measuring outcomes data. And with that, we're now excited to announce a new product that we've been building called DataPRO that's built upon all of this infrastructure we've been laying over the last 8 or so years with our partners. PatientIQ historically has been known for two of our flagship products, our Clinical Pro solution. This is an EHR integrated patient engagement and patient-reported outcomes collection software that's really best in breed at measuring patient outcomes and providing performance feedback to clinicians in the EHR. The sister product of Clinical Pro is Research Pro. This is our research-first solution that really helps investigators and their collaborators, medical device companies, measure patient outcomes in the FDA-regulated study context. Our new product's DataPRO. DataPRO is built upon our customer base that includes more than 6,000 active orthopedic surgeons in the United States who are collecting outcomes data, and we're excited to unveil it today, and it's all built upon performance feedback and performance benchmarking. So said differently, Clinical Pro is the technology that you need to measure your performance and understand how am I doing, but what DataPRO answers is how am I doing relative to everyone else. So as I mentioned, over the last several years, we at PatientIQ have had this wonderful privilege of collecting outcomes data in virtually every type of care setting imaginable. We work with academic medical centers, we work with community-based hospitals, we work with private practices and ambulatory surgery centers. And today we're engaging about 2 million MSK patients a month along their care journeys and healing process. We're a data company, though, so we measure for every one of those patients where they start and also where they end up, all the way out to 1-2 years after they receive treatment. So what DataPRO does is it is effectively a real-world data product or a market intelligence product built on top of this vibrant and growing network of providers that we've been helping collect outcomes data. So DataPRO itself is, as I said, this is market intelligence built on real-world data. So we have been acquiring longitudinal outcomes on almost 40 million patient journeys in the United States. And as I said, we're engaging about 2 million patients a month. So for our customers who always want to understand, well, we use your Clinical Pro product and we understand how we're performing, but the next question we always get is how are we doing relative to our peers or other physicians just like me treating these same patients? This is the core question that DataPRO is designed to help answer, and it does this in a big and meaningful way across millions and millions of patients. So at a very high level, what DataPRO is going to do is for all of our healthcare provider customers, we're going to be rolling up your outcome scores into what we call as your organizational score. So the first question we're going to get is, well, how do you measure success after, let's say, in this example, a knee arthroplasty? What is the definition of success? So we kind of talked with many of our customers, and we first and foremost, we appreciate the rigorousness that it takes to actually quantify clinical performance of a surgeon or for a medical treatment. The methodology that we ended up landing on for measuring success is using substantial clinical benefit, or how these patients start preoperatively and where they land 1 year post-op on a validated assessment. The delta improvement, if it's above a threshold, we say that this patient got substantially better after that procedure. There's another threshold called MCID, or minimal clinically important difference. That's a lower threshold than substantially clinically better, and so we went with the higher benchmark. There is some good news that there's an authoritative body that believes in the same methodology, so we did take that into account when we defined our performance benchmarks, and that's the CMS. This is the same type of methodology they use as part of their Pro PM program, and so we've built that into our dashboard so all of our customers can get a real-time predictor of where their payment adjustments will be in that payment program. So just to walk you through at a really high level of what the software experience will be like, tomorrow we're actually going to be doing a live demo of the solution, so I'm not going to do that today. But at a very high level, we're going to be showing performance at the procedural level. So in this example, we're looking at a primary knee replacement. So we're going to be excluding out revisions, we're going to be excluding out complicated cases. So we're looking at primary knee arthroplasties. At the top left here, you could see for your institution, Medical Center 1, we're going to show that 68% of your patients achieve substantial clinical benefit for this procedure. So to me, it's a kind of an interesting number to kind of roll up all of the hard work that your staff, your providers are doing every day into one number. 68% of patients get substantially better. Or to me, the way to think about that is 68 out of 100 patients are getting better after the procedure, or 32 out of 100 are not achieving that improvement. So it inspires more questions about what we can be doing as a community to better service these patients and treat them when they undergo these life-changing procedures. But as we can see here though, that actually puts this institution in the top 10%. So that's kind of the calming effect, that even though we know not every patient on these types of assessments will achieve, let's say, perfect scores postoperatively, this is very exceptional performance when you compare relative to your peer group. So your peer group will be the PatientIQ network. As I mentioned, we're deployed at about 5,000 sites of care in the United States. And what we're finding is that about 63% or 63 out of 100 patients achieve substantial clinical benefit after a primary knee replacement. And then we break it down by all sorts of other inputs or drivers to these scores. So DataPRO wants to take it to the next level down is, well, how do we actually quantify our performance at the provider level and at the facility level? So the next core part of this technology is, in the same way we're ranking institutions on how they're performing, we actually will provide deep insights at the provider level and at the facility level. So you can slice and dice your data so you can understand high performance at the provider level as well as at the facility level, such as your inpatient versus outpatient versus ASC. And this is all meant to inspire collaborative efforts for quality improvement across our customer base. We will be providing percentile ranking of providers by SCB achievement rates, as well as some interesting information about their median baseline and one-year postoperative scores, which actually we find to be highly indicative of SCB achievement in itself. So the last core part of the DataPRO product line is not just to show you your organizational composite score or deconstruct it down to the provider and facility level, but the spirit of this program is actually how to improve outcomes. And that's what we call our compare factors tool, wherefore we will break down your patient population and compare it to our network so you can identify areas where your outcomes are deviated and ultimately where you could improve. So this is a young product. So in the beginning, we have a targeted release of factors that you can compare and slice and dice by, such as where these patients start on their preoperative scores, their mental health status, their BMI, their ethnicity, age, race, etc. But over time, we're going to be adding more and more factors that you can then slice and dice your patient population to ultimately identify where you're different and ultimately how you can improve. I'll give one quick example just to kind of drive this point home. One thing that, if you think about the nature of a substantial clinical benefit improvement, it's really where a patient starts on let's say a preoperative assessment such as a Coos Jr. assessment, and then where they end up at 1 year post-op. Both of those assessments are out of 100 points. What we know is that if you do surgery on a patient that has, let's say, a low symptomatic burden, that will actually show up on the surveys themselves. They'll have a higher preoperative score. Higher means no symptom burden, at least on a Coos Jr. for this knee replacement example. What our data shows is, after looking at hundreds of thousands of knee replacements, is that if you're traditionally doing surgeries on patients with a Coos Jr. preoperative score above 60, which really indicates a mild symptomatic burden for this type of disease state, you're only going to have about a 50%, 46% achievement rate of substantial clinical benefit. Said differently, those patients are hard to improve to a substantial margin. And why does that matter? Some might argue it doesn't matter. It doesn't matter to me as long as they end up at a good post-op score. That might be the opinion of some surgeons. I will say that CMS thinks it matters because that's the whole basis for how they are going to be applying negative payment adjustments as part of their CMS Pro PM program, which actually might amount to $5 to $10 million to $50 million for larger systems. So we at least believe that it's important to understand your outcomes. We think our role in this equation is to get the insights to providers to better understand how their treatment decisions translate into outcomes. And we're excited about DataPRO. We think this is just going to be our first dip into this exciting arena. And we welcome the feedback of our customers and all of you because we're going to constantly be innovating and adding more clinically impactful insights. So I'll just wrap with very excited to answer any questions that you have. DataPRO, we're going to be rolling it out really starting today to all of our customers as well as new customers to the PatientIQ platform. So thank you so much for your time and attention. I appreciate it.